They've been on break for over 4 months, but today Ontario MPPs are back in the legislature. One of the top issues still plaguing the government, healthcare. A healthcare system where doctors say it is at a point of catastrophe, with crowded and closed ERs, long wait times, and 2.5 million people without a doctor.
For the Premier, you know what's better than the taste of beer? The taste of beer when you have a family doctor. You know what's better than beating traffic? Beating traffic on the way to your family doctor.
You know what's better than 15 years of Liberal dithering and delaying? A government under Premier Ford that is getting things done.
Ontario's Progressive Conservative government did make one move on healthcare today, appointing former Liberal Health Minister Jane Philpott to chair a primary care action team. Its goal is to connect every last person in Ontario to primary health care in 5 years. Dr. Jane Philpott joins me now. Welcome back to the show.
Thanks very much.
So, Dr. Philpott, just last month you were addressing the Ontario Liberal Convention and your name was floated as a possible star candidate for the party in the next election. Now you're taking a job with the PCs working on primary care. Why did you take the job and are you giving up on the Liberals?
Well, I think you know, JP, how important access to primary care is to me. In fact, I wrote a whole book about this called Health for All. It was my prescription for how we can be a healthier Canada. And I have been advocating for this vision of creating a country where every single person is attached to a primary care home in their neighborhood, where they'll all have a family doctor or a primary care nurse practitioner. I've been talking to all kinds of political parties all across the country about this and trying to decide how I can best get the tools in my hands to be able to deliver on this vision. And this opportunity came up with the province, and it seemed like a really excellent way to be able to actually make the vision come to life.
Does this preclude you from working with the Ontario Liberals or running for them in the next election?
I'm not going to run politically in any upcoming elections. I've decided to take on this particular role, but I have always said that I will advise and support anybody that wants to help fix healthcare across the country. And the vision is out there. I've tried to write down as much of it as possible in the book to describe what I think we need to do. And I actually hope every political party across the country in the upcoming elections will be running on a platform of universal access to primary care.
Let's dig into the issue. As you probably know, data from Our Care Initiative, it's this outfit out of the University of Toronto, has pegged the number of Canadians without access to primary care at 6.5 million. Is this system, are we able to actually solve this problem, or is it we have to start to dismantle the system and maybe start turning towards more privatized aspects of the system, because every sort of reform to this point has not really solved the problem. In fact, it's getting worse.
I'm so glad you asked this question, because people do sometimes think that this is an insolvable problem. It's a huge problem, as you said. If 6.5, 7 million Canadians don't have a family doctor or any other access to primary care, that's a massive problem, but it is absolutely fixable. And I say that with extreme confidence because many other countries in the world have fixed this, and they've done it by intentionally designing and implementing a system where every single person in their jurisdiction will have access to a primary care team. So if they have done this in countries all across Europe, we absolutely can do this in Canada. We can't do it instantly. It won't happen overnight, but we've never actually tried to do this. We have a very hodgepodge, ad hoc approach to primary care. It is time for provinces across this country, and indeed, I hope the whole country will do this. We'll maintain a commitment that every Canadian has a right to primary care, and I'm really glad that we're going to get to show how it's done in Ontario.
You said you can't do it overnight, but the government's not giving you that long of a time frame to kind of implement this, to connect every Ontarian to primary care. They're giving you about 5 years' time. Hopefully it's done sooner from their point of view. Do you think that that's enough time to actually implement this system you're talking about? Can they actually connect people to a family doctor in 5 years' time when we know so many hundreds of thousands of people in this province don't have access already?
It's a great question, JP, and I certainly hope we can do it as fast as humanly possible. A few things take time in terms of growing the health workforce, so we need to train more family doctors, we need to train more primary care nurse practitioners. It takes time to build new clinics and hire teams of primary care professionals to work together in those teams. I'm going to be extremely ambitious in my new role. I'm going to map out a plan over the next 2 or 3 years. We're going to have to determine exactly where the gaps are the worst, where the needs are the greatest, and invest in additional resources for family doctors and family health teams, primary care teams to work in the communities that need them the most. I wish we could do it for every community across the province immediately, but I think people have been beyond patient so far, and we need to do this as fast as possible.
You mentioned training. I have done some stories in the past on international medical graduates who are trying to get a residency spot in this country. So we're talking about Canadian citizens and permanent residents, often Canadian-born people who go to school in Australia or the United Kingdom or the Caribbean, come back to Canada trying to get a spot where they can launch their career here in their home country. But they find they can't because there are so few residency spots set aside for these IMGs, as they're called. Do you think it's right that we are turning away, based on some of the data I've seen, up to 1,000 Canadian possible family doctors every year because there are not residency spots for them available in this country? Is this something that governments have allowed to fester? They've ignored the issue, and will you be pushing the Ontario government to make more residency spots available?
Great questions, something that I'm asked often, and I'm happy to report to your audience that across the country, including in Ontario, a lot of progress is being made, has already been made in the last couple of years and will continue to be made. Is a massive expansion of medical education right now. Every Ontario medical school has grown. There are new medical schools being added, and we're seeing the same kind of thing across the country. So that helps for one thing. There's also expanded residency positions, including hundreds of new positions in family medicine. And I'm happy to report that because of that, there is a lot more capacity to take in internationally educated physicians, whether it be Canadians who have gone elsewhere to be able to get their training, or whether it be people who were born elsewhere and trained elsewhere to come. So already, I believe there's been at least a doubling, if not a tripling, of positions for internationally educated physicians to take up family medicine spots in Ontario. I think we will see that continue to grow. So I think the news on that story is changing quite rapidly. We still have to maintain really high standards. We need to make sure that people are fully qualified to be able to be licensed to practice in Canada, but we're seeing a lot of movement on that front.
Let's just end on something that's unfolding here in Ottawa. You were a former cabinet minister with Prime Minister Justin Trudeau. You sat in his cabinet and obviously left during the SNC-Lavalin affair and have been sort of on the outs, I guess, since then. But do you think that the Prime Minister should step down at this point? You might have heard that nearly 24 Liberal MPs are kind of gathering signatures now, trying to force the Prime Minister to step aside later this week when they meet for caucus on Wednesday. Do you support that initiative? Do you think that Trudeau should step down now after 9 years at the top?
Well, I'm not going to weigh in specifically on that because it's not particularly my role to be able to do so, but I certainly believe that Canadians expect great governance. They expect a governance that will have an ambitious plan to meet the needs of things like healthcare and housing and affordability and all of those things. And so, you know, I'm sure the Prime Minister is giving some great thought as to whether he is the person to continue to lead his party. And most of all, I wish whoever is running the country will do their very best job to respond to the very real needs of Canadians.
Do you think he's the person who should lead the party?
You know, I think that there's increasing dissatisfaction and a sense of a need for change. And sometimes that change means a need for a different leader. And I'm watching as closely as you are to see what's going to happen in the coming days.
All right, let's leave it there. Thank you so much, Dr. Jane Philpott. Appreciate you coming on.